Hey everyone, it's Jennifer. This is my week 80 gastric bypass post-op update thing. Today is Tuesday, September 17th, 2013. Sorry for the bright light. It's sunny outside and I need the sun. Like, I'm pale, so I need the sun, but emotionally, I need the sun. So, just kind of ignore it. And ignore the pajamas too, because I'm lazy and I'm tired and I'm off work, so I put the pajamas on and that's just what you're getting, so whatever. This week, week 80, I weighed in at 214.8, which is up 1 pound from last week, and I don't really care. As long as I stay within my weight range, I'm cool. This is decaffeinated tea. I just recycled this cup over and over again, so don't get mad at me. Decaffeinated tea, it's fine. Anyway, so I'm not really worried about my weight. As long as I stay within my weight range, which is like between 210 and 215, I'm cool. Sorry, my throat bothering me. Last week I went to have my blood, I had blood work done last week. I had to do my physical, my drug testing for work, and they did blood work at the time, so I went today and got a copy of my results for my own personal records. And I'm pleasantly surprised at the results. Maybe out of habit, I just expected I expected like the sugars to be high, I expected my cholesterol to be crazy. I did not think that I was going to do well, but all my results are like, I want to say like near perfect. I'm not at the high end and I'm not at the low end. I'm like right in the middle of every range for every test that I'm supposed to be in. And I'm not used to that. Like, when getting blood work done, you have to get blood work done every 3 months, your first year after surgery. And I'm used to, I always was worried about those results, and they always came back fine, and now I've had this done, and I'm 80 weeks out, so that's like 18 months, a little over 18 months, and my blood work is still showing, like, I'm healthy, and that's weird, because people at my weight you don't perceive as being healthy. People at my weight, you don't perceive them as having weight loss surgery. There's a lot of people I know who are 214? Who are 214 when they start. And I had to lose 109 pounds to get to this. Just crazy and embarrassing, but it is. So people don't really see me often as a bariatric patient, and people don't often view me as being healthy. But I got paperwork to show it, so you're wrong. Anyway, the only thing that I was high on, and I don't know what this, well, I'm not a high on. The test was high. Anyway, bad joke. The only abnormal result that I had was for something called alkaline phosphatase. Phosphatase, I don't know if I'm saying that right at all, because I don't know all this language and stuff. The range was supposed to be between 0 and 100, and mine was 144. But tomorrow I go and see a new family physician. Sadly, my old family physician, who I love, her name is Dr. Rice. She's in Detroit. Love her, love her. But she's in Detroit, and I'm paranoid, and she's not in a good area of Detroit, and it makes me even more paranoid. So I decided I'm going to start with a new family physician who is actually right down the street from me, and I know no place is really safe, but my city is safer than Detroit, hands down. So, starting over, the new family physician, so I'm going to take her these blood test results and see if she can tell me what that is. Well, hopefully she can tell me what that is if she's a doctor, but hopefully it's not anything big. And if you know what it is, please tell me in the notes, because I'll probably look it up on Google anyway. But besides that, I have acquired a new aversion to one of my favorite foods ever. I don't eat a lot of lunch meat. The only lunch meat I really eat is Polish ham. So I either buy the Crocus Polish ham or the Polka Polish ham, which apparently is not available everywhere. A lot of you probably have no idea what it is. It's just a type of lunch meat. And I've eaten it because for one slice, it's 50 calories, but 10 grams of protein. So if I wanted to grab 3 slices real quick for breakfast, that is 150 calories, but it's 30 grams of protein. So that's what I was doing. And starting yesterday, I don't even know what it is. It's like the texture of it or something. I tried chewing it, and I tried to get this thing out of my head, but my head kept telling me that I needed to spit it up, that I didn't want it, my body was rejecting it, basically. And I don't know why. And I tried to eat it today, and I almost got sick again. It was like really forcefully making myself eat it. And I don't want to eat like that. I don't want to be forcing myself to eat anything. So I'm like, I don't understand this aversion. Usually aversion to particular foods happens shortly after surgery. Me being 18, 19 months out, I don't understand this at all. I don't get it. I hope it's just a phase, because that's a major source of protein for me. But we'll have to see. I'm very shocked of this issue. Lastly, this is mostly just an issue that women who have had surgery are going to face, or possibly have faced, or at least know somebody who's faced. About 6 months after I had surgery, I had some hormonal testing done, and discovered with that hormonal testing that I have PCOS, which is polycystic ovarian syndrome. Apparently I've had it for like well over a decade, and nobody ever told me. Nobody even tested for it or thought to test for it, or if they did, they just never told me. Polycystic ovarian syndrome, the two main, I guess, obstacles that it gives you is it makes it nearly impossible for you to lose weight, and it severely limits your ability to have a child, a full-term child. So when you combine that with the fact that I have fertility issues of my own, I have a hard time carrying to term, and now learning that I have a hard time staying pregnant, or even getting pregnant will be hard. You add that to the fact that I'm single, not in a relationship, so not having sex, and in addition to that, I am 34. Once you get to be 35, and you get pregnant at 35 or older, you are considered a high-risk pregnancy, because your chances of having a baby with Down syndrome dramatically increase. So my age and my relationship status, or lack of status, combined with my fertility issues, combined with knowing that I have PCOS, the chances of me ever having a child are looking less and less likely, which kills me, honestly. But trying to come to terms with it and just accept it so it doesn't hit me all at once. But it's not set in stone. You know, my sister has PCOS. She's not been formally diagnosed, but her symptoms are much more noticeable than mine have ever been. And she had my niece. So it's not impossible to have a child, but you kind of have to be having sex to have a kid, and I want to be in a relationship before that aspect of intimacy ever occurs. And I don't know, it just doesn't seem very likely. So all of this being said, I'm going to see my OBGYN next week, and I'm having my Mirena taken out. Mirena is the form of birth control. It's an IUD, which stands for intrauterine device. It's an implantation that they put in your uterus, and it prevents you from getting pregnant for up to 5 years. You can only have it in if you've been pregnant before, so I've met the qualifications, and it hurts like a bitch when they put it in. It hurts so bad. And you're supposed to be able to keep it in for 5 years, but I need to be proactive and possibly creating the reality of me ever having a child. And, you know, I'm not in a relationship yet, so I'm not in the circumstances yet where it would ever happen at this point, but I need, for my own mental state, I need to, geez, don't cry, need to do something proactive to make it seem like I'm at least trying, doing my part, I guess. So I'm going next week and having that removed, and I don't know if I'm going to ask her to redo the PCOS testing, because when you've had weight loss surgery, I don't know if it reduces the symptoms or if it actually takes the PCOS away. But I know it dramatically, reduces the effects of PCOS. So I don't know if I'm going to have her redo the blood testing. Jesus, really bright. I don't know if I'm going to have her redo the blood tests or not, but I would like to know if it's still severe, or if I even still have it, and then kind of go from there. And if I have to end up going through extreme means, I don't know. This is all preemptive at this point. But so I'm going to see my OBGYN next week, and we'll see what happens. Other than that, I really don't have much else to say, which is good because I'm already at 10 minutes. So I will talk to you guys all soon. Thank you so much for watching, and I guess that's all. So I will see you next week or the week after. Have a good week. Bye.